Hi, I'm Amandeep. I'm a GP and a digital health consultant. You might have heard the term telehealth and even started using it. But if you haven't, or you're a bit confused about how to, let me explain what it is and why it's of benefit to you. A telehealth appointment is exactly the same as seeing a healthcare professional in a clinic, but you access them remotely or virtually using technology, like through your phone, a computer, or even a tablet. But just like in a clinic, it is safe, private, and confidential. You might use telehealth to see any number of healthcare professionals, a GP, a specialist, a psychologist, or a dietitian, for example. And in the future, you may also use special devices to monitor your chronic diseases, such as diabetes, via digital devices in your own home. But the principles of the appointment are the same. We are there to listen, to help diagnose, treat, and manage any concerns or conditions you might have. However, outside of simply more access, there are a couple of additional benefits for patients when it comes to telehealth. The first is convenience. You don't have to travel or pay for parking. You can see someone from the comfort of your own home or even your office without taking time off work. You don't have to sit in a waiting room, and if you have young children, you don't have to drag them along to an appointment for you. And it is easier to access if you have a disability or a chronic condition that makes it harder to get around. Ideally, you'll still see someone at your local clinic via telehealth, but it also means you have options if you can't get into them when you need to, and this is especially important for people who live in regional or remote areas. To be clear, telehealth doesn't have to replace face-to-face consultations, but it's a great option if you can't get there for any reason. And there's a couple of ways we can do it. Simply via the phone or a video call, just like when you FaceTime, Skype, or Zoom with a friend or a colleague. Speaking of which, you can always have someone with you, or if the technology allows, dial in with you as a support person. You'll book in the same way you usually do by calling your clinic or by hopping on their website and choosing a telehealth appointment. Then, to set up for your appointment, there's a couple of things I'd recommend. First, you'll need your phone, computer, or tablet and be ready to go a few minutes before your appointment time, somewhere quiet and private with no distractions. And if you're doing a video consultation, make sure the lighting is good so the doctor can see you, for example with a window in front of you rather than behind you. Some conditions might require you to have access to simple measurements. So if you have things like a thermometer or a BP machine and you think you might need them for the consult, please bring them along. Something I'm asked a lot is, but doesn't the doctor need to see me in person? The answer to this a lot of the time is no. We can examine a wound or an eye, for example, by seeing it on video. We can order investigations, prescribe medications, do repeat prescriptions, discuss blood test results, or adjust treatment plans, even just to tide you over while you're waiting to see someone in person. There is a lot we can do over telehealth, probably more than you'd think, and we're very skilled in asking lots of questions, and of course encourage you to ask any questions too. Healthcare is a two-way conversation and a partnership, which is why telehealth is particularly useful for things like psychology. Now, just as when you go into the clinic, sometimes there's still a little bit of a wait because the patient before you takes slightly longer than planned. So don't be alarmed if we're running a bit late. You can keep doing whatever you need to while you wait in your own home, another benefit of telehealth. I hope these tips help you feel a little bit more empowered when it comes to using telehealth. Please know that your practice can support you to get started and even test out the technology with you. Or you could ask a family member to help set you up. Many practices have instructions on their website too, and if not, you can check out the Australian Digital Health Agency's website for more information. The most important thing to know is this: what we don't want when it comes to your health is you delaying seeing a healthcare professional because of time, distance, access, or anything else. If you've ever taken or made a phone call or a video call, then you can do telehealth. So why not give it a go?